Welcome back. And so now we turn our attention to the health sector. Well, in the last 2 decades, it's happy to report that deaths in under five mortality has reduced, but Nigeria remains an outlier with 2,300 deaths recorded annually in child, mortality. So, what do we do? What are the challenges in the health sector to improve health in children? Let's look at that this morning. And joining us to talk about this is Mr. Eduardo Saladis. He's UNICEF Nigeria's Chief of Health. Good morning and welcome to the program, Mr. Saladis.
Good morning, Buki. It's great to be here today.
It's good to have you on the program. So as we begin, Mr. Saladis, it will be interesting to note what your observations are because UNICEF does a lot of intervention in Nigeria's health sector. So what are the progresses and challenges that we have recorded in child nutrition, child health? And also, it's pleasant to also know that we've received 800,000 vaccines for malaria. How would that also boost child health in the country?
Thank you. Thank you very much for that question, Buki. And let me just start for the good news, for the vaccines that we received yesterday. Yesterday, we had the ceremony with the Honorable Coordinating Minister of Health, and 846,200 malaria vaccines have received by the country yesterday. They are going to be deployed in 2 states to start, in Bayelsa and Kebbi. And as you know, it's going to be 4 doses that they are going to be administered to children of 5 months, 6 months, 7 months, and 15 months. So why this is a great news? So this is a great news because if you look into the world, 1 out of 4 cases of malaria happen in Nigeria. Every day in Nigeria, more than 500 people die because of malaria, and most of them are children and pregnant women. So really, this vaccine is an extremely good news. Vaccines, as you know, is not the only tool that we have to respond to malaria, but it's a very powerful tool. We have other tools like mosquito nets, like seasonal chemoprophylaxis, giving malaria treatments like in the high season. But having this new tool with us is an excellent news for Nigeria, and we hope this is going to contribute to reduce child mortality in Nigeria. When you ask me about what has been happening over the last 10, 15, 20 years, what we are seeing is that the progress reducing maternal child mortality and newborn mortality, the mortality of the new babies, of the babies that they just were born, the progress has been slow. I will not say has not been any progress. Progress has been there, but the progress has been slow. We are not reaching the targets. We are not in the place where we would like to be, right? So still 1 out of 10 children, they die before the age of 5 years old. And this is a lot. This is huge. So we hope like some of these new tools, like malaria vaccine introduction, the cholera vaccine as well that we have now at this moment for the cholera outbreaks, strengthening primary health care, creating newborn units, all of this will contribute to really improve child and maternal mortality in the country over the next few years.
Well, so the question now is, all of these things are available. Reception is now key. Reception is usually based on a number of factors, and some of these sentiments are very deep. I don't know how deep you've had to go to meet these sentiments or to try to tackle them. So just give us a sense of the job of work ahead of you, maybe how far you've come and how much more you have to do. Definitely this conversation is part of the work, getting deeper into some of these issues, but the kind of work you have ahead of you, perhaps you can paint a picture to help people understand why this is important and what they should expect in the coming days and weeks.
Thank you, Kayode. Nice to see you again. And actually, this is a very key question. So I think 3 main issues we have in front of us, right? The first one, especially when we look to malaria vaccine or to the vaccines, is to respond to the growing sentiment of vaccine hesitance that we are seeing in different communities, right? We are seeing that in urban areas in Lagos and big conglomerates. We are seeing that as well in rural areas in the Northwest. And this is because a combination of factors, including fatigue, because so many rounds of vaccines, including misinformation, distrust, etc. So one big piece of work that we have ahead in the next few weeks for the malaria vaccine, but as well in the medium and long term, is to ensure that vaccine hesitance doesn't grow, to ensure to be able to communicate to the population, to the parents, to the families, to the communities, that vaccines are safe, vaccines are effective, and vaccines results in saving lives. Nigeria has experience, right? Polio was eliminated from Nigeria thanks to vaccines. Now we have new vaccines, a new toolbox, right? We have malaria vaccine that we'll need to free of cost at the point of delivery, right? We have cholera vaccines. We're using them now in the northeast of the country, in Borno, Adamawa, etc. So it's very important that we have this coalition, right? Like we work with media, we work with social media, with traditional media, health practitioners, the government, the social influencers, the traditional leaders, the religious leaders, to ensure that the population has a big uptake of vaccines, because this will save lives. That's one. The second challenge that we have is operational challenges. We need to be able to send vaccines or health commodities, to send medicines and drugs to the last community in the most rural area of the country, in Adamawa, in Sokoto, in Zamfara, in Kebbi, wherever it is. We need to have a functional cold chain. We need to have health facilities that they work with good staff, with human resources, that they are solarized so they have energy, that there are quarters for the nurses and the midwives to sleep there, so they offer 24/7. So this is the operational challenge on ensuring that the health arrives to everybody in Nigeria, especially the most vulnerable, is the second challenge. And the third one that we have ahead is to ensure that this is affordable, right? That people can pay for the services that they need. And when I'm talking about that, I'm talking about health insurance. So how health insurance can be expanded and expanded to reach more Nigerians. And I'm very happy that before me, for example, the World Bank country director was talking about the reforms and how they can free resources for health. So if we are able to have a good mobilization of people around the tools that we have, especially vaccines, to strengthen the primary healthcare services and the operational issues, and to make affordable healthcare, I am sure that the situation in Nigeria will be quite different in 5 years from now.
So, Mr. Stelladis, do you see evidence in the intervention and provision of infrastructure by the different administrations at the subnational level, matching with a sense of urgency in the data that you provide about child mortality? Are they, providing those interventions in terms of infrastructure development? And what are your recommendations in that regard?
So to be honest, I do. I see that. So just to do the frame, as you know, in the new blueprint of the Federal Ministry of Health, is the plan for the next 3 years. They are trying to improve and upgrade and to have fully functional 17,000 health facilities all across the country. That's a massive exercise, right? And the government is doing with their own resources that they are freeing from the economic reforms, as well with loans from the World Bank, as we were seeing earlier today, but as well with development partners. So just yesterday, I was in a meeting with NPHCA and the Federal Minister of Health, telling us how many you can help us to do it, right? And how quick you can do it. And we as UNICEF, we are going to support the solarization of more than 300 health facilities, and they are upgrading more than 200 facilities, right? With the support of some donors like Gavi, the Global Fund, and others. So I sense that feeling. I sense that the Minister of Health and his team, they are looking for results. Of course, we need to change this trend. The trend is not acceptable, right? The trend of progress has been very slow over the years. So we need to accelerate. We need, for example, to reach, Nigeria is the country in the world with more zero-dose children that they have not ever been vaccinated. More than 2 million children, right? So we need to accelerate these trends. If not, what is going to happen? We are going to see recurrent outbreaks. I don't know if you remember the diphtheria outbreak last year. You saw the cholera outbreak in Lagos in June this year for poor sanitation. Mm-hmm. You saw the measles outbreak, the meningitis outbreak. Mm-hmm. So we really need to accelerate our interventions to be able to respond to these needs.
Mm. And you've made very profound observations. We hope that those interventions that you say you see will produce results in the near rather than far future. We'd like to thank you very much, Mr. Eduardo Saladis, UNICEF Nigeria's Chief of Health. Thank you for coming on the program.
Thank you very much.